My name is Michelle. I'm a physical therapist at Motion here in Minnetonka. I enjoy working with runners. I also tend to enjoy and see a lot of hockey players as well as CrossFit athletes. And in addition to that, I love sharing the world of strength training with anyone and everyone just because there's so many benefits of it. And so I love educating and teaching people all about that. So today we are going to talk about running and reducing the risk of injury. No sound. Thank you. Okay. Let me see here. Okay. Okay. Other people have sound. Perfect. Okay. Kelsey, I think it might be something on your end with the sound. All right, so we're gonna keep going then. So today we're gonna talk about running and some different ways that we can reduce the risk of injury with running. So I don't know about anybody else, but I have definitely been running more since COVID started a few months ago. And I think it's awesome. It's a great way for us to get outside. There's tons of benefits from running, whether it's physical health, mental health, like I said, just being able to get outside. And first and foremost, it's one of the things that we can still do without gyms open. So that's awesome. With that though, comes the question of, okay, so were you running before COVID started? If you were, how much were you running and how different is it from how much you're doing now? So volume is one of the probably the biggest things that I see as far as risks for injury in the clinic and injuries that we do see in the clinic. I would say volume is a huge factor. Overuse injuries are super common among runners. And so I think it's a great thing to talk about because it's something that you can easily modify. And if you're not experiencing injury, it's something that you should be aware of to help avoid injury. So when you think about any activity, whether it's strength training, biking, running, any of those things, your body needs time to adapt to that activity. That can include, yes, your muscles, but also tendons, bones, ligaments, even your heart and lungs. You just need time to get used to that activity as opposed to increasing from like 0 to 20 miles over a short period of time. And so when we think about volume, there's some different variables that we can change. And I would say the most common and the easiest ones that you can change are frequency. So how many times a week are you running? And then duration, how long are you running? In addition to that, you can also look at the intensity of your runs. So a lot of training programs will have different intensity runs throughout the week. And so it's something that when you're developing a training program or when you're looking at, week to week, what you're doing for running, those are things that you want to keep in mind so that we're not increasing too much too fast. So again, think about what you were doing before this started and what you're doing now. And then I didn't mention this earlier, but I'm happy to answer questions, you guys, as they come up throughout this. And so just type them in the Q&A box at the bottom, and then I will answer those as we go. I think that's probably the easiest way to get them as they come. So it looks like we've got a question about Couch to 5K. And do those programs account for this? I would say that they do. I think the Couch to 5K programs that I've looked at do a really good job of making that increase very gradual. And that's I think that's why they were developed, is just so that you're not going from no running at all to trying to run a 5K. And so most of the ones that I've seen will actually even start with intervals of running. So you might run for 30 seconds and then from there you would go to maybe a minute and walking for a minute and do that for a period of time. So I do think that the Couch to 5K programs do a really good job of taking into consideration volume. I think outside of those, we probably run into more problems with volume when we see people training for half marathons and marathons. That's where you can really start to see problems with volume. And then I have another question here about the heat. So yes, that is definitely a factor too. I think I want to say it's the Weather Channel, or there's some resource online, and I can look this up too. But there's something that actually has a really great graphic that looks at the temperature and the humidity and how to factor that into exercise outside. So yes, if you're not used to exercising in the heat, so like a day of today's temperature, for us, you're going to want to take that into consideration and maybe do a little bit less than you normally would, just because your body also has not had time to adapt to that heat. So any other questions before we move on to the next slide? Awesome. Okay. That's okay. Perfect. Okay. So on the topic of volume still, so one way that I like to have people look at how much they should be increasing their volume is keeping it simple with mileage, but then just taking into consideration some of those other factors, such as the intensity of your runs, heat, all of that sort of thing. So if you think about mileage, a 10 to 20% increase in mileage per week is what we would consider the sweet spot. If you get to above 30% increases in a week, that's going to increase your risk for injury. And this is, there's some research out there that has looked into this, and that's kind of the numbers that they've come up with. So keeping that increase at 10 to 20% is a good place to be to reduce your risk for injury related to volume. So then outside of volume, there's some other things that we can look at that can help to reduce your risk for injury. Let's see here, I have another question. So talk about how to combine walk, run. Does that make a difference in the actual distance versus time spent on your legs? Yes, definitely. So if you're at a spot where you're not necessarily running consistently for, say, 30 minutes, but you're doing a walk-run combination, that is not as easy to follow that 10 to 20% rule as far as mileage goes. And so it just gets a little bit more tricky because you're doing the combination of walking and running. And so usually with that, the route that I'll have people go is start with a run of like 30 seconds. And then from there, they'll walk for a minute and they'll repeat that maybe 5 to 7 times. And we actually, in the clinic here, we have a program that we'll give to people that looks at that walk-run combination. And a lot of times we'll use that after injury, after surgery, or for someone that's just trying to get back into running. And so, so that's an area where you're just going to be gradually increasing the intervals of running versus looking at your mileage. So starting at 30 seconds, then you might work up to a minute of running and a minute of walking. And then from there, maybe 2 or 3 minutes of running and a minute or 2 of walking. And so you can play around with those numbers. They don't have to be perfect. And so there's some variability there, but back to the question, you wouldn't look as much at the mileage. So, and then I've got another question here about running as part of a sport during practices. Let's see, also playing tennis, running on the treadmill daily, but varying incline duration. Okay. Let's see. Okay, so I really noticed that when I play tennis, is there a way you can general strength training to keep this from happening? Yes. So we, oh, and then another question as well about treadmill and outdoor running. So two parts to this question. So one was about strength training, which we are going to get to later. So I'm going to save that for then. And then also a difference between treadmill and outdoor running. And I would say for the purposes of this talk, yes, there is, but not so much that I would get into it into great detail. So I don't think it's something where it's a significant difference for the purposes of this talk. And then let's see. Okay, I'm having trouble opening the Q&A. Can you see the Q&A? Okay. Let's see here. Okay, I'm gonna get to those later because I'm having trouble opening them. So we'll get to the questions that are under the Q&A in a minute. And so, but otherwise, if you want to put them under the chat, it looks like that is working perfect. Yeah, if you guys, I'm having trouble opening the Q&A. So if you want to just put them under chat, that's gonna work the best, I think, here. So, okay, so getting back to this slide, talking about ground reaction forces. So high ground reaction forces are associated with running related injuries. Ground reaction forces are basically the force that's going through your leg when your foot hits the ground. So you've brought that leg through on a stride, it's hitting the ground. We're talking about the force that's going through your leg as that foot hits the ground. So higher forces there can put you at an increased risk for tibial stress fractures. So stress fracture relates to too much stress on the bones over a repetitive, over a period of time. So repetitive stress on the bone more than what it can handle, and typically not enough rest for that bone. Patellofemoral pain is basically it's a term that we use for generalized knee pain in the front of the knee, a common area that we see pain within runners. And then plantar fasciopathy, so plantar fascia, the bottom of the foot, that's an area that is also high injuries within running. And then also Achilles tendinopathy, so pain or dysfunction at that Achilles tendon behind your ankle. All right. And then, okay. So then, and I don't see any questions right now, so we'll keep going. Besides those ones that were in the Q&A. So if you guys want to move those over to the chat, that would be awesome. So bear with me too. I'm not a Zoom expert here as I keep going back and forth between slides. So, okay. Cadence. Cadence is something that we can modify to actually change that ground reaction force that we just talked about on the last slide. So cadence refers to the steps per minute while you're running. So if you think about like every time your foot hits the ground, and it would be one foot and then the other. So right, left, right, left, right, left. How many times that's happening in a minute is your cadence. So typically with running, we'll see people somewhere between 150 to 180 steps per minute. And that's something that we commonly will measure in the clinic with a metronome. So on most smartphones, you can, if you just search in the App Store for metronome, you'll find one, and you can actually figure out what your cadence is while you're running. I know Apple Watches, Garmin's also tend to have, most of them have some functionality for you to be able to know what your cadence is while you're running. So they have the capability of telling you what that is. But metronomes work great as well. And so increasing your cadence can actually reduce those forces when your foot is hitting the ground. So if you're not landing as heavy, there's less stress on all of those joints, bones, muscles in your leg. And so a 5 to 10% increase has actually been found to make a difference in those forces. And so again, that's something that you can figure out on your own. And this is something that we commonly will do in the clinic too. If someone's having pain with running, we'll get them on the treadmill, have them run for a little bit. If pain develops, we'll increase their cadence by 5 or 10%, and then have them run at that faster cadence, same speed on the treadmill, but a faster cadence, and just to see if it changes their symptoms at all. So it's a way that we can change how you feel when you're running and hopefully keep you running without having to scale back how much you're running or, you know, take a break from running completely just because of pain or an injury. So if you think about a 5%, so say your cadence was 150, where you're like, yep, this is where I feel comfortable. This is where I would normally run at. Okay, so it's 150. If we want to increase that by 5%, we would increase your cadence to 165. So on that metronome app, it allows you to change the cadence. So it'll say like beats per minute. And so you would change beats per minute from 150 to 165, and then you would set that to play. And then you would try to run to that cadence. So it's going at 165 and you're trying to match your feet to that same beat. And I think there's actually apps on Spotify or playlists on Spotify that will say like 170 to 180 beats per minute. So then you can actually listen to music even that is supposed to be within that range of a cadence. So a couple questions here that we'll pull up. So, okay, let's see here. Okay, so I see a few questions that are pretty specific. So just for the purposes of time, I'm gonna try to keep the questions pretty generalized versus specific injuries, because we could probably spend a lot more time on all of those. So if you guys don't mind, and I'll provide my email at the end of this. So if you have specific questions, I will be happy to answer those via email. I do see a question here about stride length. And yes, so if you think about, as far as cadence goes, if someone has a really long stride, their cadence is going to be lower. And so I do think that there's a correlation between someone having a really long stride and someone who doesn't. There has been some research that's looked at leg length and stride length. And so when we take that out of the equation, so once you disregard the differences in people's leg length, then we're not as worried about it. But if you're looking at just cadence in relation to stride length, a longer stride is going to have a lower cadence. And so if someone is having pain with that, then we'll definitely try to increase that cadence, and they are going to feel like they're taking a lot shorter steps as they're running, but that's okay, just because we're trying to decrease the forces that are going through that leg. And let's see here. Okay, so I think, so there was a few questions there about stride length, so that covers those. And let's see here. Okay, perfect. So moving on. Okay, shoes. So this is a hot topic. I will tell you, if you look at the research that's out there, there's not a ton of sound research as far as like specific people requiring specific shoes, because I think you have to take every person into consideration, and there isn't a one size fits all here. But I would highly, highly recommend, if you are looking for a pair of running shoes, I would definitely go to your local running store, because they are amazing resources for this, and they are super knowledgeable. And that's anyone that comes into the clinic, I'm always recommending that they see someone at a running store because they understand the different types of shoes. And a lot of times I will work and collaborate with those running stores just so that we're on the same page, and I'm looking at the person and what they're dealing with, and then they know the shoes. So it's a really great way to get a good pair of shoes. So I'm not going to get into a lot of detail as far as shoes go today, but just kind of giving you an understanding of when you're going to the running store. There's different types of shoes based on your foot type. And to very simply break it down, you can either look at stability for a shoe or you can look at cushion. And so the other factor that we're going to take into consideration outside of that is if there's a history of injury and how that might affect the type of shoe that you feel the most comfortable in. But again, check out your local running store. They're a fantastic resource for this. All right. So next, my favorite topic, strength training. So a lot of people will ask, or I will ask them what they're doing for strength training, and they will say that they're running. Well, doesn't that strengthen your legs? Yes, but no. So strength training is different than running in a sense that running is an aerobic activity. So within your body, you're using aerobic or anaerobic. So that means metabolism with oxygen or metabolism without oxygen. And so there's two different systems that your body is using. Running is an aerobic or using oxygen type exercise. Strength training is anaerobic. And so it's stressing your body in a different way when you're strength training, but there are very, very many benefits of strength training for runners. And there's a ton of research out there that supports this for improving your running economy. So how efficient you are when you're running, as well as your performance. And then also there's some research that has shown that it does decrease your risk for injury as a runner. And so I encourage all runners to incorporate strength training into their training program or training routine. And so strength training exercises, we'll get into that a little bit more, but also I think it is interesting to know that plyometrics or explosive exercises, so if you think about jumping, box jumps, burpees, things of that sort, can also be beneficial because it's more of that fast-paced, explosive movements, which can be helpful for running as well. So getting into strength programming a little bit more. So what that should look like, at least 2 days a week, you should be doing strength training exercises. 2 to 3 days a week is a great program to shoot for. Using 40 to 70% of your 1 rep max resistance. So what does that mean? So a 1 rep max is, in the fitness world, a way that we can measure how much weight you can lift one time. So if you think about a squat, how heavy can you go for 1 repetition of a squat? Now, a lot of people aren't going to have that, and that's okay. I don't expect most people to have that. But it's a way that it gives us a way to understand what percentage or what weight in comparison to that would be a good amount to use for your regular training purposes. So if you don't have a 1 rep max, think about on a scale of 0 to 10, 10 being max effort. I could not do another rep if I wanted to. Think on a scale of 0 to 10, you should be somewhere between a 4 and a 7 when you get done with an exercise where you're working on strengthening. So that gives you a good goal to shoot for, to keep yourself challenged, making sure that you're getting those muscles fatigued and working them the way that you should be. So today we're going to go over a couple exercises, 3 in particular that you can do at home without any equipment. And I think it's just a great way to get started with doing some strengthening exercises. They're all good options as well to be able to add dumbbells too, or resistance bands, so that you can make them challenging even as you start to get more comfortable with them. And so we'll go over those here in a second. And then I think there was a couple other questions here. There we go. Okay. Hill work for strength if we don't have access to weights. So still not necessarily strength training. That's just taxing your aerobic and anaerobic systems a little bit differently, but still wouldn't be considered part of that strength training regimen. But an awesome way to work on increasing speed for running. But like I said, so we'll go over these couple exercises even without equipment. And I think there's different ways, while you don't have access to weights, there's different ways that you can make these exercises and other exercises more challenging by going super slow. So if you think about a squat without weights, if you go really slow through that squat, that's gonna fatigue you a lot faster than just going normal pace up and down. You can also add holds to the exercises that you're doing to increase the difficulty without having to increase the weight. So we are going to go over these 3 exercises here. So a single leg squat, a soleus lunge, and a single leg RDL. So a single leg squat, great for runners, because if you think about every time you're landing on one leg, that leg is having to stabilize you, absorb shock, and it looks relatively similar to that position that you're in for the single leg squat. The soleus lunge is, so the soleus muscle is one of your calf muscles, and it's a very important muscle for runners. It's one that is working overtime for runners. And that's a good thing. So we want to make sure that it's a strong muscle. So we're modifying the lunge to target that muscle a little bit. And then the last one is a single leg Romanian deadlift, or RDL. And that one is targeting the back side of your legs, so your glutes, your hamstrings. So between the 3 of these, you're targeting different areas of your leg. And so we're going to go over those here. So I'm going to stop sharing my screen here. And okay, so you guys should be able to see me. Okay. So I'm going to go over these exercises with you here. So we're going to start with the single leg squat. So for a single leg squat, you are thinking about, so you're going to start on one leg. You're thinking about keeping your hips level. So this is super important as you move. And so thinking about it when you start should help throughout the exercise. So if I have my hands on my hips, they're level. One of them isn't dropping down. And sometimes we'll see that as you go into the squat, where this opposite hip starts to drop. So we're trying to keep those hips level the whole time. In addition to that, you're also looking at your knee position in line with your foot. So as I start to come down into a squat, my knee is staying right in line with my foot. It's not coming in this way, which is another common error that we see. So hips are staying level, knee is staying in line with the foot, and then I'm just going up and down, nice and slow to start with, just so that you're making sure that you're focusing on control in those different spots. From the side, I am also thinking about keeping my foot flat. So my hips sit back a little bit, and then my knee starts to bend. I'm not letting my heel come off the ground. So from here, if I'm here, I don't want my heel coming off the ground like that. So I have to sit back a little bit more and then just back up. So that's the first exercise. The second one that we'll go over is that soleus lunge. So you're starting in a lunge position as if you were just going to go up and down, but you're going to hold it in that lunge. If your weight is back more like this, it's going to be easier for that front leg. So I would hold it here and then just go up and down. If I want to make it harder, I lean forward so there's more weight on that leg, and then I go up and down, and you can see my leg shaking. So like that. And then the third exercise was that single leg RDL. So starting on one leg again, from the front, I'm just bending forward. My back is staying flat, and then there's a soft bend in my knee the whole time. So then from the side, soft bend in my knee, but I'm not squatting as I do the exercise. So I'm hinging from my hips. So my back stays flat, I hinge forward, and then I use the back of my leg to pull me back up. So I'm going down, and then slowly back up. So as you'll notice, like I said, I'm not squatting as I go down. My knee stays in the same position the whole time. And then this one's easy. If you do have resistance bands or weights, you can hold those in your hand, or a band can go under your foot, and you can add that. Okay, so let's see. Oh, hey, I got these Q&A up. Awesome. Okay, so one of the questions here was, if you don't run over the winter but do other sports like skiing, what would be a good distance to start with? So I'm always a little conservative as far as that distance goes to start with. And so it kind of depends on you and how much skiing and how much other activity that you're doing in the winter, and how similar it is to running. So I would say conservatively to start with like a mile or two and see how you go, or see how it feels and see how it goes from there. But then if you're more comfortable with starting at like a 2 to 3 mile starting point, then you just want to be probably a little bit more conservative with how quickly you're increasing that volume. And then let's see, so how many days per week do you advise running? So depends on the person, depends on how far you're running each of those days. As far as like training programs, usually if someone comes in and is training for like a half marathon or a marathon, I don't like the 5 to 6 running days a week for that, just because I don't necessarily think that it always gives you enough time to recover. For those situations, I prefer more of like the 3 to 4 times a week. So, but again, depends on how far you're running as well on those days. If you were not running as far, then it might be more reasonable to run more days during the week. All right, let's see. Okay, on the single leg squat exercise, is it okay if your non-standing leg is in front of you? Yes, definitely. So, and you'll see the difference if I'm standing here and I put my other leg in front of me, it's definitely different. This leg is working more. Doing it that way, I like to do it on a step or like a box. So then I have more room to work with and I don't have to hold my leg up as much. But it's also going to change what the rest of my body looks like. So from the side, if I'm here, that looks a little bit different and it feels a little bit different. I feel it more on the back side of my leg and my glutes versus here. This one I feel a little bit more in my quads. So with that, it probably depends on, you know, what area you're wanting to target or what area you might need to work on a little bit more. And then let's see, with an increase in cadence, there is a decrease in speed. Is it still worth it to run? So it doesn't have to be a decrease in speed. And the easiest way to see this is if you're actually trying to change this on a treadmill. And again, I'd be curious to know. I would actually think sometimes I would say people tend to increase their speed as they increase their cadence more. And that's just kind of from what I've seen, versus the opposite. I think as we increase the cadence, most people's tendency is actually to pick up their pace. And then another question here, is there a time to shoot for being able to run 1 mile before going longer distance, 8 minutes, or how do you know when you're strong enough? Yeah, so I would say definitely not. I do not run 8-minute miles. And I think there's a lot of people out there that especially if you're running a longer distance, an 8-minute mile is not realistic for a lot of people. And I think that's okay. I think it's more about the goals that you have and what you're wanting to get out of your runs. If you're wanting to make it a really quick workout and like high intensity workout, then sticking to a mile and working on speed might be the way to go. If you're looking for a longer distance workout, I think it's okay for you to be able to run 3 miles at like a 10-minute pace. I think that's totally reasonable. And then another question here. I've heard it's better for the body to run on a surface like grass or dirt opposed to hard cement and asphalt. Is that true? Yes, in a sense that grass and dirt are not, they're more forgiving. So they have a little bit more give, so it's not as hard of a surface. But then with that comes the fact that the ground isn't always as even. So you might be more likely to roll your ankle on grass or dirt versus the sidewalk. So I don't think there's anything specific that says you should not run on hard cement or asphalt. I think with that, it just comes back to volume and giving your body time to adapt. And I think it comes down to access too. Like, what do you have access to? Is if you can go on those softer surfaces and that feels better for you, awesome. But I think there's plenty of people that consistently run on hard surfaces, and as long as you pay attention to those other variables that we talked about, I think you're okay. All right, and then let me see, I'm gonna go back to the chat here. Okay, let's see. Okay, what about if you are just getting started running? So Natalie, can you elaborate on that question? Okay, in regards to how many times per week. So I think to start running, I usually recommend people do at least a day in between when they're running. So have at least 1 day off, maybe 2. And in relation to the people that I may see who've had injury and are returning to running or just starting to run, I'll usually give them the rule of thumb that take a day off in between. If you had some soreness or you were a little, achy after running, then take 2 days off. So give yourself enough time to recover where you feel like you're back at 100% when you run the next time. So I think usually like 3 times a week to start with is a good place to start. And go from there, see how it goes for a week or 2. And if you feel like it was really manageable and you want to add a day, awesome. If it felt like it was maybe close to too much, try decreasing it. Awesome. Okay. Any other questions about those strengthening exercises? Awesome. Okay. So then I'm going to go back to the presentation here. And okay, so we went over those. And then aside from all of that, so what is the strongest risk factor for running related injuries? And I actually found this interesting too when I was looking at the research, and it is previous injury. So if you've had a previous injury, you're at an increased risk from another running related injury. And so I think all that means is that if you're dealing with something that's painful or you've had an injury from running, get it checked out, get some help for it. I think if nothing else, just having some education on what this looks like moving forward, or maybe there's a couple things that you can target to work on to make sure that you're not having pain in the future, I think can be huge and help prevent things from happening in the future. And so how can a physical therapist help? So there's a ton of different things that we can do in the clinic, and it could be as little as a single day assessment, see what it looks like when you're running. Running assessments I do all the time, whether it's someone who's just coming in because they want to see what it looks like to run and get some tips for things that they can work on, or if they're having injury and they have pain related to running and we want to see them run to see if there's something there that might be contributing, or if there's something that we can change while they're running just to make it more comfortable, kind of like cadence. Aside from that, other things that we're going to look at in the clinic is how you move, what your strength looks like, what your mobility and flexibility looks like. So we're taking what everything looks like in the clinic and seeing how that might contribute to a specific injury or pain that you might be having and how we can start to address that. Outside of that, we also always work on getting you a customized strengthening program so that you have something that you can continue to use in the future as well. Because like I said, I think strengthening is super important, and it's something that we should all be doing throughout the years for the rest of our lives, just because there are so many benefits of it. And so getting you a program that's specific to you based on if there's specific areas that would be beneficial to target or focus on. And then, making sure that you are comfortable with everything that you're doing for those exercises. And then I mentioned this earlier too, we often provide return to running programs. So a training program that gets you back to steady state running for an extended period of time without having pain. And so more than anything with that, it's just guidance to make sure that you're progressing at the appropriate rate and you're doing that comfortably. In addition to that stuff, some other things that we commonly will do in the clinic is some manual therapy, whether it's to target certain areas that are painful, not moving as well. Dry needling is another option. So same type of needle they use in acupuncture, but we use them going directly into a muscle. And so we're trying to stimulate a response in that muscle to get it to relax. It kind of acts like a reset. And then blood flow restriction is another tool that we use in the clinic. And that is a way that we can work on strengthening, especially when there's pain associated with exercises, and that's limiting you from increasing strength. All right, let's see here. And then I know there was a couple questions. Okay, so will you have notes to post after for these exercises, video link, or email us your notes with a link? So we're gonna post this recording on our YouTube page. It's also gonna be on Facebook, but on the YouTube page, we can post a link to the exercises. I'll make sure that you guys have instructions for those too. And what I think I might do is put the instructions for the exercises on our YouTube page as well. So you can just click right on the link there. And then another question here, what if you have a previous injury that's not running related? Is that still a risk factor for running related injury? So in my opinion, yes, just because if that wasn't addressed, it may change the way you move. It may change how you're running. And again, I think it's something where it shouldn't make you, think twice about running. I think there's still obviously many benefits of running, but it's something where getting it checked out, making sure, or if you are still struggling from this previous injury, just making sure that you're seeking some guidance as far as continuing on to prevent future or further injury. So I think it can still be a risk factor. Depends on how well that previous injury was addressed and if you feel like you're back to 100% or not. All right, and then I know there's one more question on the Q&A, and I'll get to that in a second here. While I'm still on the PowerPoint, I just wanted to give you guys an option for something to train for. So Mile in My Shoes has their downtown runaround, and because of COVID, they are going virtual. So it's the weekend of August 23rd. And Mile in My Shoes is an awesome nonprofit organization. Let's see here. Oh, I don't think that's gonna load. So we'll just come back here. So Mile in My Shoes is an awesome organization. So proceeds from this event support Mile in My Shoes members who are currently living in shelters or exiting incarceration. So they're a fantastic organization. You can actually get involved with them volunteering. But if nothing else, this downtown runaround has different options. They do a 1 mile, 5K, and a 10K race. And so check them out. You can sign up for that, and it's going to a great cause. So if you need some incentive for training, this would be a great one. And then if you guys have any other questions, I will take those as well. And then I know there was a couple Q&A questions, so I'm going to pull those up here too. Okay. So let's see here. Okay, so let's see. Yes, there's going to be a recording. And then hip flexor problems, strengthening versus flexibility. Good question. It depends. I think that it can be one in certain situations, and it can be other. I would hate to generalize. And so I think with running, I wouldn't say the hip flexor is a muscle that you should be using to a great degree. So I think there's other muscles that should be doing more. And so it might, in that case, it might be something where it's being overused and it's just irritated because of that. So it's hard to say. Bad answer, but it depends. And let's see here. Okay. Any suggestions of running groups or ways to connect with others looking for running buddies at similar levels? Yeah, so I know a lot of and right now is a little bit different just because I think of everything that's going on. People are limiting how much they're getting together with other people. But in the typical non-COVID world, most running stores also do an awesome job of having different group runs, and they do a great job of making them accessible to everyone. So they have different distances, different levels. The Lakes Running in Excelsior does them. I know Mill City Running in Minneapolis does them. So checking out some of those running stores is a great resource. And that's probably where I would start for something like that. And let's see. Foam rollers, yeah. So foam rollers, I think, are great. And so the question of before or after, I think they can be used both before and after. So you're looking at using them for different purposes before and after. So before, it's going to be more warming those tissues up, getting things ready to move. And so usually if you're doing that, I would say I would definitely combine it with some dynamic movement. So I wouldn't only foam roll before you run. I would definitely combine it with something active, whether it's some, you could probably even do these exercises that we talked about. If you're doing them before your run, you're not going to do them to the degree or to the fatigue level that you would if you were doing these strengthening exercises separately. But you would be doing those exercises more just as a way to get your muscles firing and warmed up for your run. And then after that, you could do just a short period of foam rolling. Afterwards, it would be more like a cool down, getting those tissues loosened up a little bit. I would look at it afterwards more as like in the place of passive stretches after the run. And I think they're awesome. I think that it isn't something that I would spend, a half an hour doing, but I think they can be a great tool to work on some target areas where you feel like those muscles are a little tight and tense before or after a run. And then another question about landing on your heel versus the front of your foot. Yes. So that is another question that has been, I would say, controversial for a long time. And I don't think it's beneficial to have someone change. And I very, very rarely would have someone try to change the way that they run if they land on their forefoot versus their heel. The only time I would try to change that is if they're having pain or they have a specific injury that I think is directly related to that. So if you are striking more at your heel, you're likely going to use the muscles in the front of your shin a little bit more versus if you are striking towards your toes, like more on the ball of your foot, you're going to be using your calf muscles more. And so it just changes the way that you're stressing those legs when you're landing on them. And so again, I very, very rarely try to have someone change because I don't think it's always useful. And I don't think it's something that is worth addressing unless there's something that I very specifically think is related to how they're landing on their leg. But I think there's also these other variables that we've talked about today that you can change that would still make a difference even without changing the way that they land. Because it's a hard thing to do. I mean, you've been running a certain way for a really long time and it's hard to change that. So another question about stretching before versus after, and I would say it's kind of the same thing as the foam roller. Stretching before should be more dynamic. So it should look more like an active stretch where you're moving as you're stretching versus afterwards could be just like a stretch and hold for 30 seconds. The static stretches where you just hold a position isn't something that I would do before a run. And let's see here. There's a couple other questions, I think. I think we got them all. Okay. Do you guys have any other questions before I let you go? If not, I'm going to go back to that presentation and my email is on there. So I'm going to leave that up here. And I see a couple other questions here, but here's my email. If you guys have any questions specifically, happy to answer those via email. Like I said before, if it's something really specific to like a specific injury, I can do what I can over email, but also it might be something worth coming in for too. So, it looks like here, okay. So there's my email. And then I'm gonna just X out one more time because I think I see 2 more questions on that Q&A page. I apologize again for the, the back and forth here. Okay, let's see. Here we go. Okay, awesome. That was it. Thank you guys. I hope you learned something. Like I said, let me know if you have any questions. Otherwise, enjoy your week. And if you do get outside to run, go at a time where it's not so hot. All right, guys, have a good night.